All right. We are just about live. Hey, everyone in Lupus LA community that's joining us today for our next iteration of News from the Lab. We're really excited to have the creators of LuGENE here today and Dr. Wallace, co-founder of Lupus LA, to talk us through some of the high points about the test, what you need to know, how it works, and how it might affect the future of lupus care. So, Dr. Wallace, if you wouldn't mind just briefly reintroducing yourself and kind of just jumping right in.
Well, good evening, everybody, or good afternoon. My name is Dan Wallace, and I'm a rheumatologist. I'm based at Cedars-Sinai, and I also teach at UCLA. I currently run the lupus clinic at Cedars-Sinai Medical Center, in addition to having a consulting practice. I've been involved in the practice of lupus almost before Peter, but not quite since the 1970s. And some of the problems we have had, or some of the issues we've had with diagnosing lupus, is being able to ascertain how active the disease is and what metrics we can use to try to predict what's going to happen in lupus patients. Historically, we know that there are something called acute phase reactants, which are uh, measurements such as sedimentation rate or C-reactive protein, looking at CBCs and certain blood counts to try to look for lupus activity. However, these are very, very vague and they're not very precise. Peter Lipsky, who's on the screen here with Amrie, worked at the National Institute of Health and headed NIAMS, which was the major lupus research agency and still is, and for many years. And as part of his research, he's been looking at something called RNA-seq or RNA sequencing, which is when you look at how cells behave in tissue culture and in other ways, you can measure or ascertain how what features of lupus are being presented. Also, in addition to that, we can see by looking at different cell types how active the disease is and what types of cells are being manifest. There's also a newer type of lupus called type 1 and type 2 lupus, where type 1 lupus involves inflammation, which is usually treated with an anti-inflammatory. And there's also a newer type of lupus that Peter's been involved with the people at Duke University called type 2 lupus, which involves cognitive dysfunction, fatigue, pain, and a lot of aspects of the disease which don't necessarily show up on the traditional acute phase reactant blood tests, but nevertheless cause significant alterations in quality of life, which influence lupus. As part of this, as part of looking at this, what Dr. Lipsky and Amrie Grammer have done is being able to sort lupus into about 9 different silos, where certain aspects of the lupus have certain characteristics. And on the basis of that, we can look for flares, we can look for markers which might indicate improvement. We can look for type 1 versus type 2 lupus. And I've had the privilege of working with Peter on this for several years, but now he's going into what we call, I guess, beta testing or clinical studies where my lupus patients are being tested to see what flavor of lupus they have, so to speak. And on the basis of that, this might be able to advise or guide me as to how I would manage my lupus patients. Should I use an immune suppressor? Should I raise steroids? Should I be careful about certain aspects of the disease? And we've done about 20 patients so far. And it's very, very interesting to see the sort of phenotypes or types of cells and characteristics of the behavior of how people are with lupus. And hopefully, our center and about 10 other centers that are studying this will be able to guide lupus patients so that their quality of life would be improved. And this is a major breakthrough, and it's going to be available by summertime, and it'll be hopefully paid for by insurance, and it'll help improve the quality of life of our lupus patients. So I don't know if
Thanks so much, Dan, for those comments. I'm Peter Lipsky. I'm the CEO of Ampel. We've developed the test. And I should say, Dan gave a very good summary of us, but he was a little bit humble about his own accomplishments. I mean, I think it's safe to say that Dan is the leading figure in lupus uh, clinical practice, application, research in the country. The reason that we're working with Dan is that his clinic is outstanding, and he is one of the best clinical researchers in the country. Dan has been doing this, as he said, since the 70s. He was initially trained with Ed Du Bois, who was really the godfather of lupus, and he's carried on that tradition for many, many years. Folks in LA should be very pleased to have him. He's really a quadruple threat, meaning in academics that he does clinical research, he does clinical care, he does teaching, and he still finds time to do things for the community's benefit, such as work for Lupus LA and work for a number of other voluntaries that contribute to making life better for patients with lupus. So it's a real pleasure this evening to have a discussion with Dan, and I'd like to introduce my co-founder of Ampel, Amrie Grammer, and she'll tell you a little bit about the background of LuGENE, and then I'll be available to talk about some of its clinical implications.
Well, thank you, Peter, and thank you, Dan and Lupus LA, for hosting us this afternoon and tonight. I'm a PhD immunologist. I've come looking at the lens of lupus with the background of understanding how potentially scientists and, at the end of the day, doctors and their patients can understand where an individual is in a moment in time with their disease, to understand if there's a risk that a flare could occur, and if there is, to know specifically what's abnormal, so that doctor and patient can chart a path, as Dan was talking about, to be able to address it. I also worked at the NIH with Peter. We first started working together in Dallas, and we wanted to focus on the dynamic RNA. Dan talked about RNA-seq. That's the machine that just manually sequences every RNA in every cell in your blood to understand what's abnormal. So my brother's a lighting designer. I like to make the analogy. DNA is what we inherit. It never changes. But in a disease like lupus, if we understand the RNAs, the switches that are on and off, then we can understand what's wrong and chart a course to get to stability and low likelihood of flare. Dan, did you want to ask some questions about the test itself? And I think Dr. Lipsky is the best one.
Well, what's involved with getting the test done in a doctor's office, and how long does it take to come back?
So the beauty of this test is it's no different than any other in terms of the patient experience. So basically it's a blood draw, half a teaspoon of blood in a special tube, and that's all the patient experiences. From our end, we are looking at the expression of genes in each cell in your blood. So we generate 100 million data points from that half a teaspoon of blood. And then through the analytic pipeline that we have, which involves machine learning and a kind of explainable artificial intelligence, we can tell exactly the status of the immune system of patients with lupus. We can tell whether or not certain cells are activated or quiescent, whether or not certain chemical mediators of inflammation are upregulated or not. We get a full profile of what's going on with that patient, and then we convert that to a report. The report gives basically numeric a number of how normal or abnormal the immune system is in that patient. And then we do the same in order to say whether or not a patient is in one of the specific subgroups of lupus. And then it tells you specifically which of these pathways are abnormal. So from a huge amount of data, we reduce this to three important questions. Numerically, how abnormal is the immune system? Exactly what group do you belong in? And exactly which pathways are abnormal. From that, we can tell a number of things. We can tell whether or not your current medical regimen is controlling your immune system. And we can tell if it is, that we can translate. We have a huge amount of data that if your immune system is under control, that means you're very unlikely to have a flare over the next 1 year if you stay on your current medication. If your immune system is not under control, we can tell you exactly why and what is not under control and what molecular targets there are for specific drugs. We can tell whether or not your interferon system, for example, is upregulated and whether or not anifrolumab might be useful. We can tell whether your B cell axis is abnormal and whether or not Benlysta would be useful. We can tell whether macrophages and other cells are abnormal and whether or not other drugs might be appropriate. So this will provide a lot of information that currently is not available to the clinician, not available to the person living with lupus. And we think that it will make for better decision-making, more precise selection of drugs, and also will allow the patient to have the peace of mind to know that if their immune system is under control, they're very unlikely to have a flare. And we think that will remove some of the current uncertainty that goes along with clinical practice.
So uncertainty is also anxiety. And a lot of lupus patients are very apprehensive that they might be in a flare. And Dr. Lipsky published a paper with the people at Duke last year that was able to demonstrate that individuals with lupus who also have fibromyalgia have certain markers that other groups don't. And we might be able to say, you're not in a flare. This is your fibromyalgia. And this will change the way one's attitude is towards the disease and also the approach to treatment.
We agree, Dan, and that's a very important point. What this has also said clearly is that pain, fog, cognitive dysfunction, fatigue are actually part of lupus. And we could demonstrate that there are certain molecular pathways that are abnormal in these people. They correlate very well with the signs and symptoms of pain, fatigue, cognitive dysfunction, but they also identify novel molecular pathways that could be targeted with new therapies. So we're actively talking with pharmaceutical companies about the opportunity that understanding these pathways can give them in terms of applying new medication. And we think it's very important for the patient's well-being and state of mind to understand that the fatigue and the pain that we as physicians aren't very good at dealing with are actually part of lupus. And it really isn't something we can discount. It's something that we have to address. And we think that this test will give molecular clues on how to address that problem. And that, I think, should assure patients that there is a way forward to deal with these symptoms that can be so distressing to them.
I think that's a good point, Peter, and I'll elaborate. LuGENE, the blood test, is understanding what is abnormal in the body, in the immune system, in inflammation. And that can have a variety of ways of expressing itself, including pain, brain fog, as well as all of the other symptoms that we think about with flare. So Dr. Wallace had asked how often LuGENE, the blood test, would be gotten. Well, when you get the test and you get the report, you'll see there's either yes, no, does the individual have a likelihood of flare for the next year? And then talking about which of the groups that Dr. Wallace mentioned the individual is in, the patient will see the pattern of their gene expression, those light switches off and on, and a report detailing what cells, for example, B cells, what pathways, for example, interferon, and what functions are abnormal. So a physician and patient could discuss this. Now, the most severe patients often see their physicians 4 times a year. LuGENE is measuring dynamic change, so it can be used as often as is necessary to guide back to stability, back to baseline. When we're gearing up in the summer, the lab will make a turnaround of the report in 7 to 10 days. Right now, Dr. Wallace is one of 10 groups around the United States that are part of a study. And you can find all of that information on the website and also on Lupus LA, where Dr. Wallace's practice, also in Charlotte, coming online in New York City at Feinstein and Northwell and Phoenix. 6 other sites will be coming online in the next couple of months. LuGENE is all about understanding a patient's journey, where they are at this moment, and really stimulating a discussion with the healthcare team to understand how to get to stability.
I think the point is that there are many pathophysiologic mechanisms that are active in lupus. There's inflammation, there's blood flow, there's coagulation, there's a variety of these mechanisms that all interact with each other and can compound or diminish some of these aspects as well. And this helps put it into context. So we could say, give a patient an idea of what's really going on in their system and in their brain.
Exactly right. LuGENE involves looking at 32 separate features of these patients. And it's really the pattern of those 32 features that allows us to group them and to make predictions about their prognosis. In the words of the FDA, LuGENE is what's called a monitoring biomarker. It's a biomarker, means it's something that you can measure accurately, and monitoring means it can be used numerous times to track what's happening with a patient. So if a patient comes in and they get a LuGENE test and It says that they're stable. It is likely that in the discussion between the patient and the physician, um, a decision will be made to lower the medication. That means that in a number of months, another LuGENE test will probably be used to determine whether or not the patient stays in remission. If a patient is having active disease and goes on a new medication, the test can be used to monitor the response to the therapy. The reason we look at RNA rather than DNA basically is your database, tells you everything that you could do, but it tells you your potential. It's not telling you what you are doing. RNA is active. Some genes are on, some are off, and it's the pattern of genes that are on and off that directs your cells to behave in an abnormal way or a normal way. And by tracking RNA with this test, we have a dynamic way to look at the changes and also the response to medication and whether or not a medication is appropriate and whether the dose is correct and whether or not it will put a person into a state of immunologic inactivity, which means that they'll have a very low likelihood of flare. So it's a new kind of a test. We're very excited about it. We're excited to be working with Dan and his colleagues as we test it out and more. And as I said earlier, we expect it to be available in the summer for commercialization. And
This is something that insurance will pay for,
we're
correct?
working very closely with insurance, with the Centers for Medicare and Medicaid Services, along with private insurers, to point out the uniqueness of this test and to prove to them that it will not only increase, improve care, improve well-being of patients, but actually also be cost effective in terms of decreasing visits to the emergency department, decreasing adverse events from medications that are inappropriate and things of that nature. So we're deep in that discussion. It's going very well, and we expect a positive outcome.
Peter, some of the questions are asking about if person living with lupus, if their doctor is interested in finding out more, if they're interested in participating in the study, what are next steps?
Well, we have a very active clinical operations group. All of the information is on our website, Ampel BioSolutions. You can see all about it. And we're happy to respond to any healthcare professionals who are interested in participating or learning more about the test.
I'd like to hear from Susan as a one who deals with patients, or Mia, all the time. How does this address a lot of the concerns that you get?
Yeah, absolutely. We had so many questions even from the announcement, and a lot of people even now asking how they should be asking their doctor about this come summertime, or how to approach that conversation.
Well, over the next few months, beginning really on May, appropriately Lupus Awareness Month, we're going to be launching quite a bit of education about the test in order to build up to its official launch. So there will be quite a bit of information available from us on the website and through other venues so that we can make physicians available, aware of the test and what it can do. And as I said, we have a phone number and email access address on the website, and we're happy to provide information to any interested patients or healthcare professionals.
Certainly. And we've actually linked to everyone listening right now. We've linked to the announcement and website below in the captions. So you should be able to click on that to learn more and check out additional information about the test, its announcement, and where anywhere else that you would need information for at least up to this point. And we'll continue to be posting and sharing the news as things continue to develop. But this is really exciting. It's just such positive news for the future of lupus in general, but our community. And we thank you for all of your work and collaboration, and for taking the time, all of you, to give us a bit more insight today. We really appreciate it so much.
And thank you very much for giving us the opportunity to discuss this with your constituency and to chat with Dan and with the leadership of Lupus LA. For us, it's a wonderful opportunity, and we commend you for all the great work you're doing in LA, which does filter out to the rest of the country. So thank you very much for giving us this opportunity, and we are available to discuss it more, to answer questions. And Dan, I think, taught me years ago that if we can help patients, we've really done an extremely important thing. And that's one of the driving forces of Ampel, to really provide something that will help patients who are living with lupus. And we hope we've achieved that. And we hope to have the opportunity in the future to talk about how much this has had a positive impact. So thanks so much.
It's wonderful.
And Peter and I have been focused on lupus together for over 30 years, and really a long discussion and collaboration with Dan. Very excited to now be speaking with Lupus LA. I put the informational email in the Facebook Live chat. We very welcome feedback, comments, discussions. We're happy to have follow-up discussions. Appreciate everybody's time today. Dan, thank you so much for hosting, and Susan and Lupus LA.
Thank you, Lupus
So
LA.
much.
Thank you, Peter and Amrie.